Good evening and welcome to the webinar. My name is Steve Johnson. I'm a professor at Weill Cornell Medicine in the Department of Healthcare Policy and Research. I'm also the Director of Graduate Training for the department. I'm joined here today by my colleagues, Dr. Arian Jung and Dr. Mark Unruh.
Hi, my name is Arian Jung, and I'm an Assistant Professor of Healthcare Policy and Research at Weill Cornell and Director of the Masters of Science in Health Policy and Economics.
And I'm Mark Unruh, Assistant Professor of Healthcare Policy and Research.
Thank you both for being here, and thank you to all of you watching for joining us today.
So if you have any questions during this presentation, please feel free to type them directly into the chat window on your screen. And Steve and Mark and I will answer them towards the end of the presentation. Additionally, we are recording today's webinar and we'll be posting it online tomorrow. So feel free to come back to our site later to rewatch anything you may have missed.
In today's webinar, we'll discuss our three programs: the Masters of Science in Health Informatics, the Master of Science in Health Policy and Economics, and the Certificate in Health Analytics. This webinar will be useful for all of you, regardless of which program you may be interested in, as our programs have some shared courses that apply to all three programs. Steve, perhaps it'd be useful for people to know a little bit about the history of our programs.
Definitely, Mark. Here's a little bit of background on our programs and our institution as well. In 1898, Cornell University established Cornell Medical College. But unlike the main campus, which is located in Ithaca, New York, the medical college was founded in New York City due to the many clinical training opportunities that were available. Today, the college is affiliated with multiple New York City-based medical institutions, including New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, and the Hospitals for Special Surgery, Rockefeller University, and many more. In 1952, Cornell University founded the Graduate School of Medical Sciences and began to offer PhD and other graduate degrees. The institution got renamed as Weill Cornell Medical College in 1998. And just last month, we officially became Weill Cornell Medicine to better represent the breadth and depth of everything we do best: world-class patient care, cutting-edge research, and of course, top-ranked education.
Our department concentrates on studying and improving healthcare delivery to optimize the value of healthcare for patients across the country. Dr. Reno Kaushal, the chair of our department, is an expert in healthcare quality, patient safety, and information technology. Now we would like to discuss our three graduate programs in more detail. Our department has some of the strongest graduate programs in the field. We have an extremely diverse set of students, including those recently out of their undergraduate degree programs, as well as those in the field for 20 or more years. As you'll see on this slide, both of our master's programs can be completed in 1 year as a full-time student or in up to 2 years as a part-time student. Additionally, both master's degrees require a research project that serves as a thesis, which we'll discuss in more detail shortly. It's also worth noting that our academic year is unique and then is divided into 3 terms: fall, spring, and summer, which encompass 12 full calendar months. The certificate program in health analytics takes 1 year to complete and is part-time, with 1 course per term. Now, Steve, how about if we talk about our MS in health informatics a bit?
Definitely. Informatics is the science that studies how people use information and information technology in healthcare. Our program in informatics focuses on the use of information technology to organize, coordinate, manage, and deliver high-quality care. Our goal is to train our students for careers in healthcare delivery, health insurance, technology development, consulting, and academics. Here's an overview of the courses in our health informatics curriculum. Our informatics-specific courses are shown here in red, and they provide training in information systems, information exchange, and healthcare quality. Additionally, our Masters in Health Informatics explores special methods to study these systems and computational techniques to analyze the data. Both of our master's programs build on a shared set of courses. These are shown here in orange. The shared courses relate to healthcare policy and research. These courses provide training in how the healthcare delivery system functions, how to ask questions about these systems to improve them, and how to use statistics to answer and improve on challenges created by healthcare. Finally, how to work with the richness of healthcare data. Ariane, why don't we talk now about our second master's program, the program in Health Policy and Economics.
Sure, great. Our Masters of Science in Health Policy and Economics trains the next generation of leading healthcare researchers and analysts. Students learn to apply cutting-edge research methods to conduct rigorous analysis of healthcare data through hands-on experience under the mentorship of faculty members. And our alumni explores careers as a policy analysts and researchers. Here's an overview of the Health Policy and Economics curriculum. Our Health Policy and Economics specific courses shown in red provide a strong foundation in health policy and economics. Students will become well-versed in the financing of healthcare, economic components of delivery system, and the role of government. Students will also learn to apply advanced research methods to evaluate policies and programs while gaining hands-on experience in data analysis. As Steve mentioned earlier, the shared course remained the same across both programs to best train our students in how the healthcare delivery system functions.
That's right, Ariane. Another unique aspect of our programs is that both of our master's programs engage students in a hands-on research project or capstone that culminates often in a thesis or other project result. Each student is paired with a faculty mentor who provides training, access to healthcare data sets, and interaction with faculty and staff who are conducting research studies. These projects often give students the opportunity to do field work, which will provide a rich experience in healthcare delivery at Weill Cornell Medicine, New York Presbyterian Hospital, and some of our partner institutions that I mentioned earlier. In addition to our two incredible master's programs, we also offer an exciting certificate program in health analytics. Let's look at that. We created this certificate in health analytics with a working professional student in mind. Health-related organizations of all kinds are generating more data than ever before, so there of course is an inherent increasing need for quantitative methods to transform data into information that can support effective decision making. And that's exactly where our certificate in analytics comes to help. The certificate in health analytics consists of 3 courses: the Introduction to Biostatistics, Health Data for Research, and Health Data Mining. These courses provide students with basic tools needed to analyze big data in the health field.
Great, thank you, Steve. The application is now live, so you're able to apply at any time. Simply go to hpr.weill.cornell.edu/apply. Again, that's hpr.weill.cornell.edu/apply. We require 3 letters of recommendation, which can be submitted anytime during the application process. Once your recommenders have written their letters, they can send them directly to us, by emailing hpr-education@med.cornell.edu. However, we'll put the email address up at the end of the presentation as well. We require the latest transcripts from your undergraduate institutions, as well as any from a graduate degree you may have completed. You also need to write a personal statement that describes your interest in healthcare, as well as this program. We recommend that you begin working on your personal statement as soon as possible in order to have ample time to revise and edit it. Along with those requirements, simply submit the online application and the $60 application fee. We also ask that you follow up with your recommenders to make sure they have submitted your letters of recommendation. You should also follow up with your institutions to make sure that your official transcripts have been submitted. You can, of course, reach out anytime to check on the status of your application.
Thanks, Mark. Two final notes about admissions. We don't require standardized test scores for admission to our programs. However, we do strongly suggest that you submit these scores because they can really help strengthen your application. Our applicants generally submit the GRE, MCAT, or GMAT scores. Note that if you are an international applicant, we do require that you submit recent TOEFL scores.
Next, let's take a moment to take a look at our website, if you haven't already done so. So let's click here and visit our education page. There are a bunch of information that we invite you to check out, including more information about our programs, faculty, upcoming events, and our application process. As we mentioned before, our application is live, and we are available to answer any questions now.
Great, thanks, Ariane. Now let's go over some of the questions that some of you submitted during the presentation. If you have any at this time, go ahead and type them in now. As Ariane said earlier, you'll just type the questions into the chat window that's located on your screen. So Vanessa, I'm not seeing any questions on my screen, so perhaps if you see them there, maybe you could read them out.
Absolutely. So someone has a question about the pairing with faculty and how that is determined for the research project, and
Great.
at what point that happens.
Great, that's a wonderful question. Thanks for asking that, and I'm sure many of you will have other questions about the capstone project. So the way the project works, it's a key aspect of our program. The first day that you start in our program, along with your coursework, we immediately start working with you for your capstone project. And part of that is for learning about you. We know a lot about you from your applications, but we'll learn even more detail, and having you learn about who the faculty are. Our education committee, the same committee that is involved in evaluating your applications, will then be engaged in a process of matching you with one of the faculty mentors. So we try to make this a very customized experience based on your background, the faculty member's background, and where you might be going with your career. So we make every opportunity to make that matching as good as possible. So that happens right away, as I said, the first day that you come in. Ariane or Mark, do you want to add anything to that?
Oh, no, I think that's a pretty complete description. How about we move on to the next question? We have several on the screen now.
Yeah.
Wonderful.
So another question that came in is about the average GPA for accepting.
I can go ahead and answer that. So generally students have at least a 3.0 GPA, and I would say the average across both programs is a 3.5 GPA. Now it's important that we do look to note that we look at your whole application and not just your GPA. And as Steve noted earlier, submitting standardized test scores can help strengthen your application if your GPA is a little lower than you would like. Additionally, any work experience you have that relates to your proposed field of study is helpful. And your personal statement is extremely helpful, so don't overlook that. Be sure and put a lot of time and thought into exactly what you want to get out of this program and where you see yourself going once you complete it.
Great, thank you. Someone would like to know if we offer PhD programs.
Great question.
Yeah.
Do you want?
Yes, I can answer that.
Okay.
Currently, we're not offering PhD programs, but in the future, we are planning to offering the program, but not at this moment.
Thank you, Aaron. We are working on that right now of getting approval to do that. And so the coursework for the doctoral programs will be largely based on what you've seen here today. And then, as you know, what's added to the doctoral program is a multi-year dissertation project. So rich experience and research. So check back with us. It'll a year from now, and we'll let you know where we are if you're interested in doctoral programs.
So we have another question. What percentage of students who graduate from the MS in Health Policy and Economics end up in full-time opportunities right away? So we actually have our first cohort of Health Policy and Economics students just entered this fall. In the past, we have had a couple of health informatics students who decided to focus on health policy topics, and they were put into full-time positions immediately upon graduation. Just to say a little bit more about job prospects, after completion of the degree, students typically have career opportunities as policy analysts in the healthcare industry, government organizations such as federal and state health departments, research institutes, and also consulting firms. So these employers increasingly need individuals with advanced skills in analytics, economics, policy evaluation, decision science, and implementation science. So students who want to pursue further studies after our master programs are also well prepared for PhD programs. So as noted earlier, each student will be paired with a faculty member to mentor their capstone project, and also who will provide advice on career paths for them.
So someone has a question. They're interested in pharmaceutical biostatistics and wondering if this is the right program for them.
Interesting. Sure. So quantitative methods are obviously a very key part of both of the master's programs as well as the health analytics certificate program. So all those programs, as you've seen, start with biostatistics and then move on to, in other courses, to more advanced quantitative methods. So applying that in the field of pharmaceuticals, I think a number of our graduates look at opportunities in the pharmaceutical industry. There are electives in other parts of the campus that do address specific issues dealing with pharmaceuticals, drug development and that kind of thing, although those drug development is not specifically a part of any of the rest of our curriculum, but there are some electives out there. So I think to answer your question, if you're very interested in learning quantitative methods to work with health data, I think that this would be the right program for you.
Great. Another question just came in about the time frame for the application process. And for example, if you are taking the GRE in January, our application deadline is February 1st. So what I would recommend, and because the standardized test scores are not required, I'd encourage you to go ahead and submit your full application. You could, be in touch with us to let us know that the score is on its way. But it could still be reviewed even without the score since it's not required. Yeah, that's correct.
Great answer. Yeah. And next question.
Okay. So somebody has a question about the cost of tuition for the master's program. Next year, the cost of tuition will be approximately $43,000.
So that number, just so everyone understands, that's assuming that you're doing the program full-time, the 3-term, 12-month program. It works differently, obviously, if you stretch the program out in a part-time way over the next 18 months or 2 years.
I think the next question could be for everyone for both tracks. Someone would like to know what kind of work experience is required.
I'm happy to answer that. So work experience isn't required. We do have a number of students in our master's programs now who have come straight out of their undergraduate degree programs and enrolled directly into our master's program. However, work experience does help strengthen your application. So we also do have other students in our current cohort who have been out of school for quite some time and have a number of years of work experience. So it's all about the overall, your overall application, not one specific aspect, again, such as your GPA or work experience. It's a combination of all those factors.
I can add for the health informatics track, people come from a very wide range of backgrounds. Most commonly, people come either from a health background, so we have physician, nurses, and other kinds of people with healthcare experience, and those are people who then become interested in technology, or we have people from a technology background who become interested in health. And so you can have either one, and it works great, but a number of our applicants don't come from either of those backgrounds. Those are just the majority come from those two fields. So there's a tremendous diversity. Your personal statement is where you make that argument of why, based on your prior background, why you think this is the right program for you.
Okay, we have another question asking, how new is the Master of Science in Health Policy and Economics? So our first cohort actually just enrolled this fall. However, as I mentioned, we've had a couple of health informatics students in the past who did pursue topics that were more closely related to health policy and economics. So we have had students pursue capstone projects that were in health policy and economics, and I have mentored 1 or 2 students who have done that. And our first cohort for the program just entered this semester.
There's another question. So are there any combined informatics and policy programs? We don't offer the specific degree, the combined for informatics and policy programs. However, for the curriculums, there are electives that you can take for both informatics and economics track. Steve, do you want to add anything?
Sure, just exactly what you said, just that it's fine if you are finding it hard to choose between the 2 Master of Science programs, that's great, but you do ultimately have to pick one of the tracks, and because that's the degree you're going to get. But as Ariane just said, our students from both programs are interacting with one another and in many of the same classes, all of those shared classes that we talked about. So there's a lot of overlap already and a lot of interaction. So it's great if you're interested in taking electives in either program.
So another question about what percentage of students do half-time versus full-time. So to give you an example, this year, over half of our students are attending full-time. You know, we could see that trend continue, but we see that the students, if they're working, they have some flexibility in their jobs so that they could be attending full-time.
Yeah, I guess it's worth noting that most of our classes, or many of our classes, are offered in the evenings, so that allows a lot of students who are working full-time to take them. But there are some classes, just due to scheduling constraints, that are offered in the afternoon.
Yeah, we try to make the classes as late as possible. As Mark said, it's just often not possible to fit everything into the week and have it in the evenings and have it possible to take.
Steve, I think we have a question that you might be the best suited to answer. So some institutions offer a master's degree on their way to the student receiving a PhD. So for example, you might receive a master's degree after your first year or two in the program and then continue working towards the PhD. So is that something we'll take into consideration when we have a PhD program in place in the future?
That's a great question. Yes, that's been my experience as well. I've developed other programs that have master's and doctoral students in them, and yes, that is typically the way it works. So I would expect that if you were to complete the master's before we create the doctoral program, we would take that as your coursework toward the doctoral degree, and I'm sure there can be a way to work that out with the registrar in the graduate school. So I wouldn't be concerned about trying to make that happen.
Great. There's another question. Someone was wondering, we noticed that there are no healthcare management classes, and wondering if that might be implemented in the next, in the near future.
So we may offer some classes in healthcare management. However, we don't have a plan to offer actual degree in healthcare management and policy.
Again, I think we have another one here might be best answered by Steve. Would this MS in Health Informatics be a program for someone who's working as a junior clinical business analyst in clinical information patient care, and is the GMAT required?
So I'll answer the last part first. The GMAT is not required, but if you've already taken it, I really strongly encourage that you submit your scores. Standardized scores can really enhance your application in a lot of ways. So, but if you have not yet taken the GMAT and you think you would have time to before you apply, again, I strongly encourage you to take it. It sounds like the type of current background is a great fit for actually either track. I wasn't quite sure whether you were talking about going into the health policy and economics track or health informatics, but either actually would enhance that experience. Both involve working with healthcare data. The informatics program typically is more focused on technology, both in using the data that is generated by information technology, but there's also a whole human factors side to the health informatics program, looking at how people use information systems, how those information systems impact workflow and organization. So if those are things that are interesting to you, that might be new directions to pursue. If you're really interested in analytics with data, again, this either program I think would be a great foundation for that, of seeing what kinds of patterns and conclusions and decision making can be supported through healthcare data set analysis.
Okay, thanks, Steve. So we have another question asking, regarding the health policy and economics program, how do you incorporate changes in healthcare laws into the curriculum? So this is a great question. So not all students coming into the program have a broad depth of institutional knowledge about healthcare. So in the first term, you'll take a class that's Foundations of Health Policy and Economics, where you'll learn about the basic structure of the healthcare system in the U.S., such as payment systems, how that affects the delivery of care, and so on. And you'll also talk about a lot of changes, ongoing changes that are a result of the Affordable Care Act, for example. So these are policy changes that will continue to take place over time, and this is a really large part of our curriculum. Additionally, there are classes in the first term that all students take that focus on healthcare delivery, such as, I can't remember the specific title, Health Services Research, I believe. So you'll get quite a depth, you'll get quite broad exposure to the healthcare institutions in our country, what the basic structure of our healthcare system is, how health policy is changing and how that affects the delivery of care.
There are also federal laws like meaningful use that were designed to encourage physicians to use information systems. So there are also laws and policies that affect the informatics side of things. And so those are covered in a number of our courses. And that, of course, is always, as pointed out by the person asking the question, that's always a moving target as well. Another example would be laws and policies related to patient privacy. The public has become increasingly aware about their privacy issues, and so that's going to be an ongoing set of issues. All of that is very important in the informatics courses for discussion.
I think it's worth knowing that a lot of our students choose as part of their capstone project to evaluate these policies and see what the effect is on the care received by patients. And they'll continue. There are a wide variety of changes that will continue to take place in the upcoming years, and those will, of course, be incorporated into the curriculum as well.
Thanks, Mark. If anyone joined the webinar late, I think we're now about we're at half an hour into it, but some of you might have joined late. If you missed anything, you could ask a question about anything that you're concerned about, or if we're also happy to review any prior information that you might have missed. For the rest of you, please continue to type in your questions. These are all great.
And just to add to that, the webinar will be posted in the morning, so at any point, with a cup of coffee, you can sit down and review all of the information you might have missed.
Sure. And Steve, I think we have another question that's best suited for you. Do you have programming courses in your informatics master's programs like Java and C++?
Okay, that's a great question because that gets into the kind of program we have. Both our programs, as I mentioned, are really focused in what you might call quantitative and analytic issues. So for the master's program, it's more in that direction than in the software development or that type of programming. So what programming is there? All of our students, when they do biostatistics, certainly the informatics students, will be introduced to a language called R, which is a very interesting and popular programming language for statistics and many other data analytic uses. So while that's not the same kind of programming that you would learn for software development, you do learn a lot about how to write programs to transform and analyze data sets. So it's very targeted, that type of programming. The other part of the curriculum in the informatics track that involves is towards the end, which we're currently calling health data mining, and so that's where you learn a whole variety of computational methods to find patterns in data using various machine learning algorithms. Now that course we've taught in the past, also using the R language. I think in this coming year we may teach it using Weka, which is a special package for machine learning. We do not cover languages such as C++ that was mentioned, and so if someone is more interested in computer programming for software development, probably this would not be the right program. But if you're interested in big data and in discovering things in health data and helping to support decision making and visualization, those are all things that we do cover.
I'd also like to add that in the Health Policy and Economics program, you will have coursework where you use SAS. For example, in a health data course I'll be teaching, we use SAS to manipulate data sets. Also in the biostatistics course and likely in the econometrics course, the students will be using Stata. Okay, now we have another question here that's asking, what's the difference between a typical MPH program and the Master's in Health Policy and Economics? This is a great question. So there are some important differences. For example, most MPH programs tend to place greater emphasis on topics such as population health, epidemiology, and patterns of disease. MPH programs also tend to be more theoretically oriented, while our HP, our Health Policy and Economics program, is more applied with a practice-based focus, where you'll get hands-on experience using healthcare data. Our Health Policy and Economics program emphasizes a broader policy perspective to include, for example, payment policies, health insurance coverage, and structural issues related to the healthcare delivery system. So the goal of our program is to prepare our students to work effectively in organizations and within the related policy environment as well-trained healthcare researchers with strong analytic skills.
Great answer, Mark.
Thank you.
So we have another question, possibly for any track. I don't work in the healthcare field, but I want to in the future. Would I be able to get in?
Okay, so I'll start with that, but I think it'd be great for you, the rest of you, to comment as well. So obviously, since this is not a healthcare training program, you wouldn't be able to get entree into doing direct clinical work. Yeah, obviously, you would have to take a clinical training program to do that. However, our students definitely get jobs working for healthcare delivery organizations such as hospitals and outpatient practices. What's happening now is that all of those kinds of organizations are collecting vast amounts of data because of all the technology generates it, but they're also increasingly being pressured to figure out how effectively are they delivering care? Where can they reduce costs? And the only way they can do that is getting better at data analytics. So all of those organizations are finding a really hard time finding qualified people who understand some of the data issues and the analytic issues, as well as understanding the healthcare processes and how healthcare works. So there are definitely jobs in the healthcare world if you follow this path.
Yeah, and I'd like to note that we do have a number of people coming into the Health Policy and Economics program who have degrees in unrelated fields, such as biology, for example. So I think the important thing is within this is where your statement of purpose really is important. So you really want to explain why you're interested in this program if you don't have a background that necessarily directly relates to it. So what you plan to get out of the program and where you want to go after completing the degree. That's very, very important, and that's something you can really emphasize in not only your statement of purpose, but something that you can potentially ask your letter writers to address too.
So we have a question about admissions now. Specifically, when will admissions decisions be announced? That's a great question. And decisions will be sent out the week of March 14th.
Okay, and I'm going to throw this one again at you, Steve. What kind of jobs can I expect to get after I finish the master's in informatics? I also see that there are a lot of jobs in the field that pay well after completing a PhD program. So I'm sort of reading between the lines here a bit, so I'm guessing that this individual is interested in what kind of job you can expect after completing the master's program and how that might compare to a job you might get after completing a PhD program in informatics.
Right. So we just talked a little bit about that organizations that provide healthcare are desperate for people with a background in health informatics, particularly from the side of analytics. There's also a huge need that's sort of the data, focused on the data side of things. I mentioned earlier that there's also a need to understand the human factors side of things because there are a large number of these different kinds of information systems, and figuring out how to fit those systems into the workflow that the different clinicians and others have is very complicated. So that's just to point out a different kind of job, which is more focused on human factors. So Those are both job opportunities in healthcare delivery. Other industries that are looking for people, the insurance world definitely needs more of those who are trained in health informatics. Various consulting firms are big on this now. And software development companies. More and more companies every week, you'll see in the paper, are beginning to develop technologies that have an impact on healthcare. And so they need people who have training and know something about how computers work and how they fit in, and something about how healthcare works. So that's what our program is trying to do, is bring those two pieces together. For a doctoral program, I don't personally believe that right now to get those jobs you need a doctorate, or that most of those institutions right now are looking for people with doctorates. A doctorate would definitely be desirable if you're really, really interested in the research side of things, particularly in academia, but there are also research organizations. For those types of think tank kind of places, a PhD is typically required to get a job there. So if you're sort of aiming that high, then you would need a doctorate for those very specialized research organizations.
All right, there's another question. Is HP, Health Policy and Economics program, too technical or require high quantitative skills or econ background? So my answer is no. Advanced quantitative skills or economics background is not needed. Our core courses, which you take in the first term, will prepare you for the quantitative courses in the second and third term. For example, the core courses include introductory statistics and health economics. These classes will prepare students for more advanced courses in the program.
We have another question. Somebody is wondering if the certificate, if they take the certificate program, how or if they can transition to the master's program.
Great question. So as we pointed out, the certificate program consists of 3 courses that are spaced out 1 course per term over 3 terms. So that takes 1 year to complete. All 3 of those courses are components of the master's program. So you could actually transition to either of the 2 Master of Science programs having taken the certificate program. The downside, so I guess the basic answer to your question is yes, you can transition, and we give you complete credit for those 3 courses. The downside of doing it that way is actually is clearly it takes longer, right? It takes a whole year to finish the certificate program, and then probably another year to finish if one of the master's track following that. So I think if you're leaning towards a master's program, you think that's where you want to go, probably best to apply for the master's program.
Okay, so we have another question asking about mentoring, just a general question asking about us to describe mentoring. So one thing that's unique, I think, about our program compared to others is that we keep our class sizes and student-to-faculty ratio low so our students can get a much more personalized experience out of the program than you would elsewhere. Because of this, mentorship by a faculty member throughout the program is provided to every student who comes in. So, many students even continue the relationship after becoming alumni and working in their careers. I know personally that I've kept in touch with the students that I've mentored, and we actually correspond fairly regularly. Our faculty within the department have years of combined experience and are experts in a wide variety of fields, including health policy, informatics, economics, health services research. We also have faculty members in biostatistics and epidemiology, and others who are experts in topics such as cost effectiveness and comparative effectiveness.
So one more thing, I'd like to comment about the collaboration with nearby institutions and school. So So the being in New York City is a huge asset for our program. So local institutions are collaborating with Weill Cornell Medical College, including New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, and Hospital for Special Surgery, Rockefeller University, and the State Department of Health and New York City Department of Health, and Mennohuizen, and more. So we have very close ties to other departments within the medical college and university as well as a Cornell
Okay, I don't see any more questions coming in at the moment.
We'll just wait one more minute, just in case there's a last-minute question. As was said earlier, you can email us. I'm sure you'll think of more questions once the webinar is over, but feel free to reach out, and we're happy to help you with any questions that you might have. We still have a moment. Oh, great.
I'm sorry, we have one last question coming in here, it looks like, asking if you can meet in person or possibly have a tour of the campus if you come visit prior to applying. And yeah, absolutely. We actually meet with applicants fairly often. Just let us know in advance, and we'll try and make arrangements for you to meet with a faculty member. Likewise, if we're able, we'll try and set you up on a brief tour of our campus and try and accommodate any other requests that we can.
Right, Mark, and I'll add to that I encourage everyone who's listening to look at the website and look at the faculty in our department and described there, and see if there are people whose work it really interests you. And so, if possible, if you want to come visit, we can try to set up a meeting if there are specific faculty members you might want to talk with. In addition, if you have a strong sense that there are particular people you'd like to work with, you can write that into your application. And then, as was asked a couple times in this webinar, when you're trying to pair up for that your capstone project, those early experiences may also help narrow down who you might want to work with. Any more questions?
Looks like that's it.
All right then. Well, great questions, everybody.
Well, Steve and Mark, and I wish to thank you for taking a few minutes to learn more about our program. This is such an exciting time to be in the healthcare field, and I'm so happy to see such a strong, dedicated students in our program. I hope to see applicants from all of you this fall. Please feel free to reach out to us at any time if you have any questions.
I look forward to reading your applications.